How do TG and TgAb tests monitor thyroid cancer? Have you ever wondered how doctors keep track of thyroid cancer? One important way is through tests that measure thyroglobulin and anti-thyroglobulin antibodies. These tests are crucial for monitoring differentiated thyroid cancer, which includes the more common types like papillary and follicular thyroid cancers. Thyroglobulin, or Tg, is a protein that is produced only by thyroid cells, whether they are normal or cancerous. After a total thyroidectomy, which is the complete removal of the thyroid gland, and radioactive iodine treatment, doctors expect Tg levels to be very low or even indetectable in the blood. If Tg levels are detectable or rising, it can signal that there is still some thyroid tissue left or that the cancer has returned. This makes Tg a sensitive marker for monitoring the status of the disease. The Tg test is most effective when thyroid-stimulating hormone levels are high. This can happen naturally if a patient stops taking thyroid hormone medication or can be induced by an injection of recombinant thyroid-stimulating hormone. When TSH levels are elevated, any remaining thyroid cells are stimulated to produce more Tg, which helps in detecting even small amounts of residual disease. However, newer tests can detect very low levels of Tg without needing TSH stimulation, which improves early detection of any recurrence. Now, let's talk about anti-thyroglobulin antibodies, or TgAb. These antibodies can be present in about 10% of the general population, often linked to autoimmune conditions like Hashimotos thyroiditis. The presence of these antibodies can interfere with the accuracy of Tg measurements, potentially leading to falsely low or indetectable Tg levels. That's why doctors often measure TgAb alongside Tg to get a clearer picture. In some cases, rising TgAb levels might even indicate a recurrence of cancer, especially when Tg levels are not reliable due to the antibodies. In practice, doctors use Tg and TgAb tests along with neck ultrasounds and sometimes imaging studies like radioiodine scans, computed tomography scans, magnetic resonance imaging, or positron emission tomography scans to monitor for any signs of thyroid cancer returning. The frequency of these tests can vary based on individual risk factors, often ranging from every few months to once a year. This comprehensive approach allows for sensitive detection of any persistent or recurrent disease, helping guide further treatment decisions. In summary, Tg acts as a biochemical marker that indicates the presence of thyroid tissue or cancer cells, while TgAb testing ensures that the Tg measurements are accurate and may provide additional insights into the disease status. Together, these blood tests play a vital role in the follow-up and surveillance of thyroid cancer. Always remember, if you have concerns about thyroid cancer or testing, it is best to consult with a healthcare professional for personalized advice.